no one should speak like that. Yes, absolutely.
Thank you, guys.
Thank you.
Thanks, folks.
Her mom's running a little behind, so we might just move her elsewhere. I don't think so. Not yet. Not yet. What? Yes. Yes. It was in and out, wasn't it? And you
Hey, likewise, how are things?
How are you? Oh, there's my home. Great, perfect. And then for folks who are speaking, I have the order up here, and you can just pass it to the next person. So Dr. Pike, you'll pass it to Omari Prince. Oh.
Is this going to be on the People Action Facebook, or how can I view this?
So AARP is also dual streaming it onto their Facebook. So if you go to AARP Illinois,
Okay.
you'll be able to find it there.
Cool.
Yeah, come on in. All right, good luck with your.
Sorry?
Good luck with yours too.
Thank you.
Just want to make sure.
Okay, awesome.
And I can get a screenshot.
So we have you here, and then folks who will just like introduce whoever's next. So you can introduce Lori. You can just say, and up next is Lori Hendrick of AARP.
And
I don't know why I did that.
yeah,
You know
but
what?
I just
I typed this into like ChatGPT. It always changes names.
that's I just if there is a
No, there's nobody else
When
has
you
this.
speak, please just say and spell your name for the reporters.
okay, like spell the entire name out.
Yeah.
Okay. That's fine.
I don't know why it
It's like
says
the
that.
same ARP, they tell you this, or is this?
Sometimes it just changes the day of week. It changes names. I don't.
Yeah.
Oh, if you have stuff that I don't want you to hold this
I
one.
called it. Like
Would you mind?
when?
Just during the
They
press
might
conference,
ask
we'd
me
like
this.
for
Oh,
the
it
signs
is.
to be visible.
Oh, so are we like all sitting up here and then exchanging, or we're sitting there?
We're standing up here all
Oh,
this. Is that okay?
yeah.
Michael and.
Okay, and if you want to put yourself down, you're welcome to do that. I don't think so.
Okay. Yeah.
Just in case.
Okay. Who are we waiting on? Just gonna be Laura Barcelo and.
That's it. Omari. So you will pass it to Sukanya.
Okay.
So you can just say, up next is Sukanya with Young Invincibles.
Yep.
I'll just pass to each other.
And it's double-sided, you can make sure this side is a great prescription drugs, yes, both are on message, I guess.
I'll just.
I'm gonna stick this in, excuse me, sorry.
All right. First half of the day done. How's your day been, Omari? Yeah, true. Good?
It's right around rhythms prepared for next week.
What's next week? Just more, yeah,
You're good.
for sure.
Omari, it's nice to see you. I was with SKC last sorry.
Which?
Yeah, I interviewed.
Yeah, that's from my room, but like, I know you.
Yeah. And then I
Make them remind me.
Yeah.
reunion.
We're-
You
yeah.
said, yeah.
That's why I'm like, wait a minute, I'm doing something.
Hey, yeah.
Wait a minute. Okay, great.
I'll bet you, Brian. Yeah.
Yeah, go ahead. Do you wanna go, or does it matter? Should I go with this one? I can get a little bit more over there. Okay. Yeah, that'd be good.
And Lori, whenever you're done, they're no longer coming, so you can just, I'll just take it back and say we're ready for questions. These lights are real intense.
They are very bright ones.
Yeah. Down.
Should have brought my sunglasses. No. Yeah, it's about all. I had like a point of pamphlet for five because I have aggressive transporters. So been going through this since 23, around 20, the end of 2022, early 2023. To like try to fix the problem, maybe get back to classes, struggle. And so one of the prescriptions, just so you guys want to hear, is one of the prescriptions.
Like, can we get a little bit tighter, please? A little bit? I know it's gonna be awkward as someone speaks and like is rotating out, but let's try to get.
And it's not even covered on the Medicare prescription coverage. Because I'm on Medicare Medicaid. It's like $80 a pop and it lasts like 2 weeks. So that can add up. And it's like, that's the only really thing you can give me. Like, obviously there are eye drops, but it only does so much.
I'm right.
Right home. Yeah, definitely important. Disability, medication. I like the alcohol example.
No, you should be here. It's good you're here.
When those things do,
You never know.
it can be expensive. 4 weeks, four
And you got the shirt and everything.
prescriptions like that.
I'll be ready.
It starts to get expensive. If it was covered by the, what is it, the Rex they have? Coupon, yeah, I can have that in like $500 or something.
Okay.
For a bottle of
Oh, here she
it's
is.
about that big. Lasts about 2 weeks.
We'll start in just a second. Awesome. All right. I believe we have everyone. Good afternoon, everyone. Thanks all for being here. My name is Julia Warheit. I'm the policy manager at Citizen Action Illinois. We're a statewide progressive policy and political coalition, and we are here today because the status quo for prescription drug affordability and pricing in Illinois is just not just unsustainable, but it's dangerous. 77% of Illinois voters are worried about affording their meds. These aren't just statistics, they're patients choosing between groceries and insulin, and seniors rationing heart pills. We're standing here today in support of HB 1443 and SB 66, which establishes a Prescription Drug Affordability Board, or a PDAB. And a PDAB is an independent body with the authority to evaluate high-cost drugs and set upper payment limits on what Illinoisans can pay. Last month, we released a report that shows a PDAB could create savings of up to $190 million in 1 year alone, and these savings are really just the beginning. A PDAB lowers costs in 3 different ways. For taxpayers, it lowers out-of-pocket costs at the pharmacy counter for consumers, and it stabilizes insurance premiums for every family in the state. The report release focuses on the third aspect, state and taxpayer savings. It provides a clear roadmap to relief for consumers in the state. HB 1443 and SB 66, by creating a prescription drug affordability board in Illinois, can save over $190 million in just 1 year for only the first 10 drugs Medicare has negotiated. Here's why those savings are so powerful, though. They're automatic. Our PDAB would simply adopt the federal Medicare maximum fair prices, tongue twister, as our own statewide upper payment limits, extending those savings to our consumers who are not on Medicare and to taxpayers. When Medicare negotiates a lower price, Illinois gets that lower price too. It's that simple. And our board would also have the ability to independently set upper payment limits on other drugs posing affordability challenges to our state. And we know that PDAB is a proven method. Colorado's PDAB recently became the first in the country to set a payment limit, and they chose the drug Enbrel and are projected to save up to $32 million in 1 year alone. Colorado is proving that states don't have to be victims of a national market. We can set our own guardrails, and we need this now more than ever. With federal healthcare cuts on the horizon for 2026, up to 500,000 Illinoisans could lose their Medicaid coverage. We cannot allow those who remain covered to be bled dry by drug prices that often rise 4 times faster than inflation. We need this kind of policy, again, now more than ever. As federal shifts threaten to strip Medicaid, we need to do something for our neighbors. And we also need to fill the massive funding gaps left by federal cuts. So today we stand alongside hundreds of dedicated Illinoisans that were down here to make their voices loud and clear, and our broad coalition who is here to say enough. We are here for the millions who are tired of being treated like a blank check for the pharmaceutical industry. We're here to ensure that life-saving medication is treated as a right and not as an unaffordable luxury. The report findings are clear, the precedent is set, the savings are waiting. We call on the General Assembly to pass HB 1443 and SB 66. Our state cannot afford to wait. Thank you to Representative Syed and Senator Guzman for being our chief sponsors and champions for affordable and accessible healthcare. Next, I'd like to invite up State Senator Graciela Guzman.
Hi, good afternoon, everyone. I'm State Senator Graciela Guzman. It is my proud honor to be the chief sponsor in the Senate to Senate Bill 66, which would establish a prescription drug affordability board. I had a whole speech written, but I'm going to speak off the cuff, actually, because I think this is how raw it's feeling today. I think what I'm grounded in and why it's so important that we are here supporting this initiative is that our community members have been talking about the medical hurt that they have been experiencing for all of the reasons that Julia just laid out to us. We have an affordability crisis. That means that their ability to be able to eat, put food on the table, have a roof over their head is something that is in question for many people in our state. But what I hear often about from my constituents are those that are wrestling with the decisions that literally will mean life or death. A mom that is debating how is she going to pull funds together for the insulin that her kiddo needs, just in case he has an asthma attack. The person that is telling me that right now the cost of their insulin keeps going up, and how will they live if they can't get it? But at the same time, they don't know how they're going to make their rent. And those are the kinds of questions that are being discussed every single day by our community members all across the state of Illinois. And this one hits close to home because I was saying to folks earlier today, my uncle in El Salvador just passed away last week. And when they do, the postmortem on him, they'll say natural causes, but what it really was lack of access to his insulin. That's really the cause of his death. And so when we really think about the obligation that we have to act in this moment is to understand that a prescription drug affordability board centers what our community members need. That as a state, we can have mechanisms that protect our community, that our community members deserve to understand that their state government is doing everything in its power to yield that influence, to ensure that pharma and other influences that directly profit and take that profit into their own pocket instead of innovation or lowering the cost of prescriptions for everyday consumers would have to be held accountable via the speed up, right? So that's really what it's about. To community members all across the state of Illinois that are saying, does my assembly see me? The fact that I am sick, the fact that I want to be healthy, the fact that I want to live, we see you. And that's why we're fighting for a prescription drug affordability board, so that we can have these open conversations, so that we exert our state's power to be able to set rates, and so that we can continue to save lives in the state of Illinois. So with that, I'm happy to give it over to my fearless champion who has been doing this work in the House every day for a long time, because this has been a long-standing battle. Happy to introduce State Representative Nabila Syed. Thank you.
Good afternoon, everyone. My name is Nabila Syed. I am the state representative of the 51st District and the proud sponsor of this bill in the House. We've introduced this bill since I've first got elected, and I think of how many things have changed in the context that we're operating in. And day after day, the federal administration continues to put down new stipulations on our communities, on our state, that would make it harder for the most vulnerable people to get by. Our state is facing massive federal funding cuts. We're being forced to pick up the tab for programs like SNAP, cuts to Medicaid, education funding, childcare funding. I have organizations within my community coming to me fearful about what the next year is going to look like because they have no idea. We're operating under uncertain times, uncertainty that is keeping people's lives in the balance. And when Citizen Action came out with a report saying that a prescription drug affordability board could save our state a minimum of $192 million, I thought, what are we doing? What are we doing as a state when we allow for that $192 million to go towards lining the pockets of pharmaceutical executives rather than investing that money back into our communities, the most vulnerable among us? It is a waste of taxpayer dollars if we do not implement a prescription drug affordability board. It is injustice. It is unfair to our constituents who we were elected to represent if we go back to our communities and say, well, we weren't able to do it again this year. But I know the people power is there for legislation like this. This is why you see today in the Capitol, the halls filled with people wearing red shirts, people wearing doctor's coats, people who are on the ground. that see people in our communities making life and death decisions about whether or not they can afford to take a drug that just maintains a decent quality of life versus the many other things that they have to pay for. You know, it feels like affordability is the buzzword now. Everyone's talking about it, every candidate running for office. But the crisis with prescription drugs and the lack of affordability around it has been going on for decades, for years. And Americans, Illinoisans, have been the victim to this, while there are residents in other countries surrounding us who don't face the same high costs. So I stand here before you because I feel a greater sense of urgency. In the past few years that we've had this, I haven't been so angry and so upset, but when you see the attacks that are coming down on my own constituents, my residents, I feel furious that we have not passed the Prescription Drug Affordability Board when it's clear that this will allow for cost savings and for us to be better stewards of taxpayer dollars. When we know that this money could be reinvested in vulnerable communities and protecting those that need to be protected. So thank you all for being here, but I want to use this moment to urge my colleagues, my fellow legislators, to understand the urgency this year and why we need to pass the Prescription Drug Affordability Board and finally do right by our residents. Thank you so much, and now I will pass it along to Dr. Pick.
Thank you. My name's Dr. Michael Pick. I'm supposed to spell that, M-I-C-H-A-E-L. P as in Peter, I-C-K. I'm a rheumatologist here in Springfield, Illinois, and I've been here for the last 43 years. I treat patients with Enbrel, and I've treated them actually since this drug came out. Enbrel was revolutionary in the field of rheumatology and treating rheumatoid arthritis, as it offered patients an ability to maintain their life, to maintain their work activity, to maintain their ability to take care of their family, and without it, they would be seriously impaired. During the launch of Enbrel, which I recall and was fortunate enough to be involved with to a limited extent in trialing patients, the yearly cost of the drug back in 1998 was $11,000. Translated to current dollars, that's $22,000. The current market cost of Enbrel is $106,000. Amgen is no different than many other pharmaceutical companies. Enbrel is just the medication that was chosen, but all pharmaceutical companies do the same. But looking at Enbrel and Amgen has done various changes in their patent and protected Enbrel from going off patent. So they have no competitors in the US. In Europe, the cost of 1 year of Enbrel, as I said, in the United States, it's $106,000. In Europe, $16,000. And that's for the brand name product. For the generic product, it's more like $10,000 per year. I do want to acknowledge, because realistically, I give these drugs out all the time. They're extremely expensive drugs. And most commercial insurance companies provide reasonably good coverage, assuming you of course have commercial insurance and you don't have a Medicaid or Medicare plan. But as you all should realize and understand, the costs of these medications circle around and are recouped in premium costs that are paid by business owners and by employees, which are in my world called patients. Underscoring the high cost of these drugs has been evident most recently with the start of the new year. Every new year, patients are exposed to the fact that their companies are changing their healthcare provider, and when they do that, the healthcare provider has a new pharmaceutical benefit manager who changes their preferred medication. Prior authorizations have to be done over and over again because these patients are frequently refused. The goal of these coverages companies is to limit the amount they pay, of course, as any good company would like to reduce their expenses. As a result, these patients will undergo a high risk for having a flare of their illness, requiring more unpleasant medication to try to recover the health that they previously had. Might even oftentimes result in their presenting to an emergency room and potentially even getting admitted to a hospital. Medicare has already negotiated a price of $30,000 a year for Enbrel. And as you heard earlier, Colorado and many other states have already instituted panels to review the affordability of many various high-priced drugs along with Enbrel. Under this legislation, Illinois would automatically adopt the federally negotiated prices. As was already stated, I don't really need to review that again, but I want to admit and state that the failure of this plan being in place does significantly impair the ability of our patients to get these medications and maintain their health. Thank you. And I'd like to pass it to Omari.
Yes. Good afternoon, everyone. Omari Prince, Government Affairs Liaison for the Small Business Advocacy Council. So before I start my remarks, thank you, Senator Guzman. Thank you, Representative Naif, for this important piece of legislation. So we're definitely going to get this across the finish line this session. Healthcare premiums are skyrocketing for small businesses, making it extremely difficult for them to offer health insurance for their employees. Indeed, many small businesses cannot afford to provide group coverage to keep their employees, while solopreneurs struggle with escalating health insurance premiums as well. The high cost of prescription drugs drives up health insurance premiums. Also, the health of workforce is deeply impacting when people cannot afford important medication. For this reason, the SBAC strongly supports legislation that will support a prescription drug affordability board to put guardrails around the excessive costs of certain prescription drugs. The time has come for politicians to do more than just talk about lowering health insurance premiums for small businesses. The time has come for politicians to do more than just talk about how the high cost of prescription drugs is impacting the workforce. This is a time for action, and we are ready to see this legislation move past the finish line and be enacted into law. Thank you very much. At this time, I will pass it to Sudoku from Young and Visible.
Thank you, Amari. This is Sukanya from, there we go. Real young here, Young Invincibles. Thank you, Amari, and thank you to Rep. Syed and Senator Guzman for again echoing the gratefulness for this legislation. My name is Sukanya Ghosh, that's spelled Sukanyaghosh for the press. I am a student at the University of Illinois, Chicago, studying public health and policy. I am happy to be here and invited by Young Invincibles today to have my voice heard along with concerns for our generation. Young Invincibles is a policy and advocacy organization that envisions young adults as part of the political roundtable, empowering youth contribution on issues surrounding workforce, healthcare, and higher education. Drug affordability is important to me because I care for my future and the communities I hope to serve. As a young person and aspiring healthcare provider, I have learned that health is not only influenced by personal choices, but also by forces beyond our control. Our health does not wait for when we have finally secured a job with a livable wage and insurance benefits. And while we cannot predict when illness will interrupt our lives, we can decide how we secure the lives of those in our communities. Affordability for drugs should be accessible for everyone, no matter their age. That is why young people across the state of Illinois urge you to pass a prescription drug affordability board. Because if falling ill is a matter of chance, then access to affordable healthcare is a matter of justice. Look, young people care about drug affordability now and in the future. That's because according to a 2024 poll by the KFF, 4 in 10 adults ages 18 to 29 reported not filing a prescription, taking an over-the-counter drug dose instead, cutting pills in half, or even skipping their medication altogether. That's 40% of young adults who, aside from the everyday struggles of searching for high-paying jobs and not being able to afford their groceries, are now unable to take their life-saving medication. These are young adults we're talking about, people with entire lives in front of them.
And the drugs we need aren't just specialty drugs. They are treating chronic conditions like high blood pressure, depression, and heart disease. In 2023, 60% of young adults were estimated to have at least one chronic condition. Additionally, around 90% of children diagnosed with chronic conditions such as diabetes or juvenile arthritis are now surviving into adulthood. But these individuals are typically still forced to rely on medication without generic alternatives well into their adult life. And we must preserve their future livelihood, independence, and dignity. In 2009, Young Invincibles was founded in the wake of the Affordable Care Act to challenge the narrative that young people were invincible and didn't need health insurance. That's in 15 years later, we stand in front of legislators to fight for a future that includes our prosperity and success in the picture. After today, I hope that legislators across Illinois understand that medication is not just needed when we're old. I'm grateful for programs like Medicare, like Dr. Pick mentioned, that protect the care for older generations. But we need that same protection now. Prescription drug plays a role for many throughout all of their lives. As a public health student that is concerned for the health of communities, and as a young adult concerned for my future health, I urge legislators to establish a PDAB. Thank you so much, and I invite the next speaker, Lori.
Thank you. Lori Hendren. Oops, I got too excited. I am the Senior Associate State Director with AARP Illinois. We represent 1.7 million members, and we also represent proudly all those that are 50 plus. And first I want to thank the lawmakers for their courageous and steadfast commitment to this incredible piece of legislation. One thing I think that's just kind of compelling to me, we have the future standing before us, and she's unwavering in her advocacy for prescription drugs. We have our medical professionals, we have our lawmakers, we have business, and we have consumers. And stand before you as the voice of aging. And it's a tidal wave of consensus that this is common sense legislation. It is needed now. This is a battle that has been going on. And which, you said is so important is because the limiting your medication, limiting your food, limiting your housing options, all of that is also at the end of life. And our seniors, our members, are those over 50 plus, are consistently telling us this is a hardship. And PDAB is a way for our state to be able to not limit access. People can take their medication, but we are making a step in the right direction for affordability. No one has to choose between health and their basic needs. Illinois 50 plus are counting on us, especially now, today, to take action. That is why AARP Illinois is calling on lawmakers to pass this legislation that establishes a strong and effective PDAB. Together, we can make prescription drugs more affordable, protect our residents, and overall improve our financial and our health for all that age. Thank you very much.
Well, thank you so much, everyone. We can open it up now for questions.
I had a question about insulin. I thought we already had a cap on those costs for that one. Am I wrong?
We capped insulin, but that only applies at the federal level for Medicare and at the state level for state-regulated health plans, which is only about 18% of health plans.
We've seen this proposal floating for the last couple of years, and it really haven't seen too much movement. I'm just kind of curious, what has been the challenges so far to getting this plan moving forward, and what may be different this year?
I'll tell you about one of the years when we proposed this. It was me sitting in a room with some of the advocates and maybe 40 lobbyists opposing this bill. I think it's clear regarding prescription drug affordability legislation across the country as well as at the federal level, the biggest opposition tends to be the people whose profits this is going to impact, which is the pharmaceutical companies. So I'm optimistic that this year, as I've mentioned, looks different than previous years in the federal context. And I'm hopeful that my colleagues will see the sense of urgency behind this and call this bill in committee.
And then last year, lawmakers obviously took up, pharmacy benefit manager regulation, prescription drugs has been a hot topic.
Yeah.
Can you just talk, and I walked in a little late, so apologies if this got touched on earlier, but how does this kind of work with some of that other legislation, other reforms that have kind of been coming up in Springfield?
We'll say this, we had great legislation last year targeting PBMs. This will target the entire supply chain. And I think, well, I'll leave it at that. But I think it's necessary that we do that. I think it's way past time that we haven't been targeting both the manufacturers, PBMs, all the way down the supply chain to ensure that cost savings are passed down to the consumer.
And for the first one, I can add as well, we did get some questions about other states, and now Colorado has officially been the first state to set an upper payment limit, so we feel confident that that is evidence and proof that something like this does work and create savings for consumers and the state.
You said that the board could save 192 million within a year from the automatic discounts. Is that a year from bill passage or from when the board is established?
Yeah, so I can explain a little bit more about that. So if we took so Medicare's already negotiated for 25 different drugs. If we took the first 10 drugs alone, we use that number in comparison to what our state employee health plans pay for those same 10 drugs. And the difference in 1 year alone would be $192 million. So our board would automatically adopt any Medicare negotiated price as, extending it to all the Illinoisans that aren't on Medicare. So once our board is established and up and running, they can adopt those almost immediately. So those would be immediate savings and would also create a pipeline for future savings as Medicare continues to negotiate for more drugs. So it's really a floor, not a ceiling.
Do you have a sense of how long it would take to establish the board?
We've been learning a lot from other states, I would say. So with those learnings, we would feel more prepared to get the board up and running as fast as we could. Of course, we want to take the time to make sure we have the good board members and set up the stakeholder council. But I think around a year or so. Mm-hmm. Awesome. All right. Well, thank you so much, everyone. Appreciate you being here.
What was your last name?
Oh,
again?
Warhite.
I need-
W-A, here, my first name is Julia, Julia. Last name's Warhite, W-A-R-H-E-I-T. Okay. Warhite.
Warhite.
Yes.
Warhite.
Yes, you got it.
Okay, Allison, sorry, let me jump back.